Some of you will be familiar with the program, and we did a webinar, I think, with the office maybe about 2 years ago. So I'll just give you a brief summary of the program. Then in the second section, I'm going to talk to you about the skills we teach on the program and the approach we take. I'm going to talk about emotional intelligence, because the more evidence shows us that the more complex and challenging the conversation is, the more we rely on emotional intelligence. And I'm going to be talking about it through the filter of communication and what elements of communication are important for these conversations. In the closing section, then, I'm going to just do a quick summary and over to Lorraine and to yourselves for any questions that you might want us to answer. So you're probably familiar with the National Care Experience Programme. It's a joint initiative between the Department of Health, HIQA and the HSE, where all three organisations have signed up to ask patients, service users, families, people who use our services about their experience of care. And I just want to say now, for the purposes of this webinar, I'm going to use the term patient, if that's okay. I used to work in hospitals, that's the term I used, and the first survey we worked on was the inpatient survey. I'm aware that there are people on the webinar today who might use the term service user or client also. I like to use people who use our services, but that can be quite long-winded if you're saying it a few times. So please substitute whichever term you're most comfortable with. So all three organisations have signed up to ask people about their experience of care. And you can see there are a number of surveys running in this programme at the moment. People are asked a number of closed questions in the survey, and there are 3 open questions. What was particularly good about your experience? Anything that could be improved, and anything else that people want to add. The first survey was in acute hospitals in 2017, and I was asked to look through the feedback of that survey, particularly focusing on communication. And I read an awful lot about what patients say about our communication skills that they like and they find improves their experience, and then areas that we might need to improve on. I'm always amazed by the patient stories. So in answer to those 3 open questions, some patients give a few lines, some will write pages. And in their stories, it's almost as if they have come to our workshops, because they describe our communication skills in great detail, the skills that they like and they find useful, and the areas that we need to improve on. Here's an example of one of those stories.
One doctor made a serious error that I think could have taken my child's life. I noticed the problem and brought it to the attention of a senior midwife on the ward. She was very understanding and immediately called my obstetrician. They both sat with me, listened to my worries, and explained what they were going to do to ensure that that error would not occur again. I felt much safer after that.
So that's an example of one of the patient stories. You can find those on the webpage or in our app. And I read through the surveys every year, all of the feedback, just to make sure that we are targeting the areas of communication that our patients are talking about, and also looking for the perfect patient story that highlights the communication skills that we're trying to teach. So our program was set up in 2018, and this is the aim of our program, to improve communication to a professional level of competence. Sometimes we get people who attend our workshops saying, well, you know, I'm communicating every day, so I'm communicating since I was born. Why do I need, you know, any support in doing this? And we would like to make a distinction between the behavior, which is what we do every day, and professional competence, and that is heightened attention to and heightened awareness of communication skills, the skills that work well in these kinds of conversations, the skills that help us to form a connection with patients, and a heightened intentionality with regard to their use. Depending on the kind of conversation you're having or where you are in that conversation, you'll be focusing on particular skills. We'd like to support staff to use those skills with intention. Our program is evidence-based, so all of the skills that we teach and the materials we use are based on evidence. And we also would like to support staff to engage in ongoing reflection with regard to your communication. I'll talk to you a little bit more about that in the presentation today. I've been working in healthcare for a long number of years, I won't say, and on this program for the last 7 years. And my experience of meeting people who work in healthcare is that they are enormously caring, compassionate, and wanting to help people. Sometimes the intention, which is to be caring and compassionate, doesn't exactly match the impact that we're hoping to achieve. And it can be upsetting for healthcare staff to get feedback from people which shows them that the impact isn't what you were expecting. So when we become more aware of our communication, we're able to close the gap between what we intend, which is to be caring and compassionate, and the impact that the person feels that you're talking to. In our program, we deal with 3 different areas. So we focus on teaching communication skills. When I talk about skills, I'm talking about non-verbal communication skills and verbal skills. So an example of a non-verbal skill is making eye contact when you're talking to somebody, nodding to show that you are listening, maybe sitting down with the person at the same level to emphasize that this is a partnership and you're having a conversation with them, and so on. A verbal skill could be something like a greeting. So hello, an introduction, my name is Winnie, or paraphrasing back to the person what you think you've heard to show that you're listening and also to check your understanding. So we teach all of those communication skills in our workshops. The second area we focus on is strategies, and we teach these mostly in Module 4, which is team working, and Module 8, which is emergency situations. So an example of a strategy here is one that we borrowed from the aviation sector, and that is learning to cuss. The first C is concerned, then U is uncomfortable, S, this is a safety issue, and stop. So sometimes people ask us, well, why do you need to call stop if something is going wrong in healthcare? And it's because we know in healthcare, it's a large organization. We operate usually in large teams. So we use hierarchies to manage the numbers of people we have in the organization. And that's necessary when you have big organizations. The difficulty with hierarchy is we know that it has an impact on patient safety. So if there's a very strong hierarchy, people at the front line who are often closer to the patient and might see if something is going wrong or might see a better way of doing something, they can be often afraid to speak up. So mistakes happen that could have been prevented, or we don't find a better way of doing things because people feel they can't tell us. So this is a strategy to enable healthcare staff to assert themselves in situations where there's a patient safety issue. So rather than going directly to stop, which by the way isn't good if the patient is still awake and can hear it, and also it's not good for building relationships with people on our team. So this is a graded way of getting up to stop what you're doing. This isn't safe. If a team has agreed to use a strategy like CUS, and they're familiar with the language in it, a team member will often only need to hear something like, I am concerned. And they'll go, oh, okay, something's going on here, and might pause. And the other person doesn't need to go up as far as stop. So just to give you an example of this, in a maternity scenario, you might say, I'm concerned about Mrs. Leamy's labour. I'm uncomfortable with these late decelerations. And if the person still isn't responding, you say, I think this is a safety issue. And only then after that would you go to stop. More recently, we've been focusing in our program on the words that we use. And patients give us a lot of feedback in the surveys on the impact of the words we use in healthcare. Some of them are very supportive, and some of them patients are not happy with. So I'll talk to you about that later in the presentation today. Just at a glance to give you an idea of what's in our program, if you're not familiar with it, during the pandemic, we developed an e-learning module, which is an introduction to the program. Now, we're not recommending learning communication skills at the computer, because all the evidence shows us in order to improve our communication, we need to practice and we need to get feedback. But it's an introduction to the program. After that, if people are interested, we would ask you to book a face-to-face module workshop, either in your healthcare facility, if your facility is running the workshops, or nationally with us. We mostly run our workshops in Dr. Stevens or in the Ashley Hotel. If people are interested in becoming facilitators for the program, and we would encourage you to do so because we use a train the trainer approach, then once you've attended a workshop, you could come back to attend a facilitator skills workshop where we go through the skills to enable you to run the workshop yourself, and you get access to all of our facilitator resources. This is just a snapshot of our program. So you can see there modules 1 to 4. We encourage people in the HSE, we would like all staff to do our 4 core modules. After that, modules 5 to 11, you can see are what we call deep dives. So if you're interested in particular in demonstrating empathy, shared decision making, if you're working in an area of healthcare where there are emergencies, or you're dealing with complaints or involved in end of life conversations, then you might be interested in attending those other modules. Kelly and Lorraine asked me just to talk a little bit about the resources, and I know Kelly is going to send you some links after the webinar today. So just very briefly to let you know that when you train as a facilitator in our program, we give you access to the PowerPoint slides, to all of the teaching videos, and we use videos in all of our workshops. We find participants and staff really like to watch the scenario before practicing it themselves. All of our videos are accompanied by skills debriefs. So to help the facilitator debrief the video, you get a hard copy of a facilitator's guide and workshop documents like the workbook that you can see here on screen. For conversations like disclosing errors, that's module 3. You can see challenging consultations there if that's the one you're interested in. We have a lot of supporting materials also available on the web, so you can access these on hse.ie or on our app, which we developed last year. And we have patient stories like the one that I showed you recently, skills cards that you can print off or look at on your smart device, videos, case studies, posters, and we would encourage people to print off the posters and put them around your healthcare facilities. We know that when staff are learning new skills, the visual reminders in the workplace can be very useful. So just to talk to you briefly in the next section about the skills, we use a framework called the Calgary-Cambridge Guide. So there are 72 communication skills in this framework. Now, we know that people often use other models like SPIKES, for example, for delivering bad news, or NURSE for demonstrating empathy. And if you are already familiar with the model, that's fine. The reason we use this model is it's the most widely used framework for teaching communication skills in the Western world, and it's used in a lot of the universities here in Ireland. So when we get medical graduates, nursing graduates, for example, working in the HSE, they will have been taught communication skills through the Calgary-Cambridge Guide. So we have a common language when they come to work with us. And when we're talking about communication, then we're just refreshing the skills that they already know. Another benefit of using this framework is it applies, as you can see in all of our modules, to every healthcare conversation. So all of the skills here can be used no matter what the conversation is. I try to use a lot of the skills at home with my own family. So, and that's a point about communication skills, is they're universal. You can use your communication skills in any setting with any group of people. Here in the picture, you can see Professor Peter Gillen. So Peter co-facilitates the workshops with me. And this is a workshop we did last year with international medical graduates. This is a role play, so you can see one of our international medical graduates here in the picture, and also Owen. Owen is an actor, and he's taking the role of a simulated patient. We use simulated patients as much as possible in our workshops now at national level. There is an expense, of course, associated with that, but we find that it gives participants a better experience, especially for the challenging conversations where the actor can easily produce the emotion that's required, and it's a better experience for the international graduate. Nobody really likes doing role plays, and we want people to take part in the role plays because that's where most of the learning happens. But we like people to experience excuse me, success in the role plays. So they go away from the workshop motivated to learn new skills and maybe to come back to future workshops. So these are the 3 steps that we take. A good communication skill for giving information is always first to ask people what they already know. So we do small group work where we ask people to discuss the skills. What do you know already about, for example, the skills for listening? And then we get the discussion going and we add in any details. The next step is we watch the video. So we have videos in all of our workshops, and where possible, we're trying to produce as many videos as we can so that they are scenario and specialty specific. So we have videos, for example, of scenarios in the acute setting, maternity setting, pediatric. We don't have so many in community services yet, but we are working to produce those as well. So depending on the group you're meeting, you use different videos. And then we move on to the role play, where we give people feedback, mostly asking them, how do you think that went yourself? What skills did you use? You know, what skills, maybe if you were to do it again, what would you do differently? And that's where most of the learning happens. This is the concept of duality that we speak about in our workshops. So in order to improve our communication skills, it's almost like dancing on the dance floor and then at the same time observing yourself dancing from the balcony. And this is what we need to do. Like when you go back to this scenario here, Peter is watching the role play, he's going to give feedback. That only happens in the workshop setting. So what we need is for staff to develop the ability to watch themselves. So you're becoming aware of your communication. How's it going? What impact is it having on the person you're talking to? What skills are you using? If you're not getting the reaction you're expecting, then how can you change that up? What works well for you and what might you need to improve on? So I'm just moving on now to the area of emotional intelligence. And as I said earlier on, the more complex and difficult the conversation, the more we rely on our emotional intelligence. Most leadership programs talk about emotional intelligence, and that's really kind of where all the teaching happens. I think everybody working in the HSE, it would be useful for them to think about and get some learning in the area of emotional intelligence. We use it in every walk of life. Webinars tend to be, you know, quite static, and I know there are lots of people hopefully listening in and watching. So throughout the day today, what I'm going to do is occasionally put up the question marks here on the screen. When you see that, it's just a sign to you that I'm going to ask you a question. We won't have time to take answers from people, but I would like you please to take a pen and paper, because we know that for learning, it's better if people get involved and maybe think about something, and then you're more likely to remember it after the talk today. So when you see these question marks, please take out a pen and paper, or maybe if you want to put some answers into the chat, if you're happy to share those. And the question is, what's your understanding of emotional intelligence? Just have a think about that. And Jeanette, who works with me here, is timing me to give about 20 seconds for each of the questions. So just very briefly for yourself, what is your understanding of emotional intelligence? And then I'm going to show the answers. So when you see those questions coming up on the slide, please take a moment to type in the chat or to take a pen and paper and write down the answer. So emotional intelligence is defined as the ability to recognize and understand emotions, and then using this awareness to manage yourself and your relationships with other people. There are four what we call domains of emotional intelligence, and you can cut these in a number of ways. So there is what I see, and that's self-awareness and social awareness, and then what I do, which is self-management and relationship management. You can cut it another way and think about yourself. So being aware of yourself and then managing yourself, and then socially being aware of other people and how you manage your relationships with them. I can't go in depth into any of these areas in the hour we have together, but I would like to just briefly talk about each of them. Just a little bit of the science behind emotional intelligence. Our brains are wired for us to be emotional creatures. What that means is that when I'm in a situation, I'm feeling an emotion, I'm going to feel the emotion first, and before I get the opportunity to think rationally about it. What we need are well-developed pathways between my feeling something and then thinking about what I might do about it. So for example, if I come in the back door of my house, which I do every day, and there are hurling boots, hurleys and helmets, they're in my way and I trip over them and almost break my ankle. my first reaction might be, I feel really angry because I told the kids 1,000 times not to do this. And my reaction might be to shout at them. And we know that's not really very helpful. Might feel better for a moment, but not in the long run. So in order to create a space between what I feel and what I do with that feeling, I need to think about it and develop these pathways with traffic going in both directions. So the next time I come in the back door and I'm tripping over the boots, I stop, I say, okay, I'm feeling annoyed. What am I going to do about this that might result in some change in behavior? And the more we can bring an awareness to what we're feeling and create a gap between that feeling and what we do about it, the better our conversations are. So the first area I'm going to look at is self-awareness. And this is Carl Jung, and he was a Swiss, very clever man, a Swiss psychiatrist, psychologist, and psychotherapist. And what he's saying here is really we're so socially conditioned from when we were very young to do certain things, react in certain ways, use certain words, that unless we think about them, they're having an impact on our experience in our life and on our relationships with other people all the time without us being aware of them. So he's encouraging us to engage in self-reflection. Think about how you're communicating with people, what you do really well, and what areas you could improve on. I'm going to play you a short video clip here. It's very short, and it's John McEnroe in the Wimbledon final in 1981 with Tom Gullickson.
It was the wrong side.
The ball just came up all over.
No, it was a bit of a spread, Mr. McEnroe. That was a good one.
Excuse me?
That was a bit of a spread.
But you can't be serious, man. You cannot be serious. That ball was on the line. Chalk flew up.
Okay, so I don't know if people remember that moment, but it's an iconic moment in not just in tennis and in sport. And I think John McEnroe himself has talked about it since then. So we're talking about conversations, and we're talking about challenging conversations like disclosing errors in general. So there's a lot of emotion associated with that. Sometimes we use the analogy of the seesaw when we're talking about emotion and communication. So here you can see on the seesaw, one side is up very high. So if emotion is very high, then communication will not flow. Think back maybe to a time when you're having a conversation with somebody who's really, really angry. It's not efficient or effective to stay talking to somebody who's feeling a very strong emotion. The most efficient thing to do is to work to de-escalate that emotion. Because when somebody is very, very upset, often this is what happens. So you'll see it in the person non-verbally. You'll see the emotion on their face, on their hands, and in their whole body. When we're very emotional, our biases prevail. So that's something to think about also, to be aware of your biases. And when your emotion is high, your biases are going to come more to the fore. Our ears switch off. We just don't hear the message at all, or we don't hear some of it. When people are emotional, this is something to watch out for as well. They'll start to speak more quickly. The pitch of their voice will change, get a little bit higher, and the tone will change. You'll know that somebody's feeling strong emotion because there's more energy behind the words that they're saying. And reasoning, high emotion affects our ability to reason. The higher the emotion, the more difficult it is. So in order to move the seesaw into this position, we need to use some good communication skills, because that's a better use of your time when you're communicating with somebody, is to try to de-escalate the emotion. So just coming back to self-awareness, and we don't have time to go through all of these today. Have you thought about your communication style? What is your own personality type? There are many instruments out there, and they're just a way of looking at personalities. Do you know what kind of personality in general you have in particular situations at home, in work? How do you communicate yourself, and how do you like to be communicated with? How do you think other people perceive you? What's your conflict handling style? There's an instrument here, you can see it on screen, called the Thomas Kilmann conflict instrument. And that looks at how assertive people are. Assertiveness relates to, you know, your own concerns, looking after your own concerns. And on the other axis, you can see cooperativeness. So that's really how interested you are in other people's concerns. And when you plot those against each other, you get 5 different styles for handling conflict. So are you a competitor, collaborator? Do you go for compromise? Do you avoid conflict altogether? Or do you end up accommodating? So it's important to be aware of all these areas. What are your emotional triggers? In our brains, we have what's called auto-appraisers that are constantly scanning our environment for threats, especially threats to our interests. So do you ever find yourself really, really annoyed and you've no idea how you got that annoyed or what happened? So you can see here on screen, this is taken from the conflict dynamics profile. Sometimes if you meet somebody who might be, for example, a micromanager, or you don't find them to be very reliable, for example, with deadlines and so on, and that can really push your buttons. They're called hot buttons. So are you aware of your own emotional triggers? Sorry. I do see some hands coming up, Kelly, but I guess that people are putting, I can't see what people are saying. So if there's any issue, you might let me know, please.
Oh, that's okay, Winnie. Yeah, all's okay, thanks.
Okay, thanks very much. So just to think about, that's a whistle-stop tour through self-awareness. Just for yourselves to take a moment and think about, maybe you already do something to improve your self-awareness, or maybe it's something you might think about after today. And what one area might you do, might you focus on to improve your own self-awareness? And that could be things like any of those instruments that I've shown you. So taking the conflict dynamics profile, looking at the Thomas Kilmann instrument, how do you handle conflict? Maybe engaging with the HR department in your area to do one of the personality profiles like Myers-Briggs. In Module 4, we use an instrument called the Colors Insight Program. So there are some tools out there that can help us with self-awareness, and maybe thinking about the concept of duality, being on the balcony for some of your conversations and watching yourself, or buddying up with somebody maybe as well, can be useful to get feedback, somebody that you trust. Meditation, I can see Siobhan, thank you, coming up there. Meditation and mindfulness, yeah. And again, you know, some people do different things, and not the same things don't work for everybody. So what will you focus on? Okay, so the next area I'm going to look at is the second area of emotional intelligence, which is self-management. Here you can see a quote from Rudyard Kipling, who wrote the Jungle Book. And this is taken from a poem that he wrote called If. And there are quite a few lines in the poem. You can see the first line here: if you can keep your head when all about you are losing theirs and blaming it on you. Then the poem ends with this line: yours is the earth and everything that's in it, and what's more, you'll be a man, my son. So Rudyard Kipling was born in India into a British family. He's written a lot of books and a lot of poems. So I'm going to show you a very short video clip here and thinking about the area of self-management. You might be familiar with the movie The Incredibles. And here we see on screen Bob Parr, and this is his boss. Let's see what happens.
Request claim on claim number 158183. You will be...
Got him yet? Then where is he?
Mr. Huff would like to talk to you in his office.
Well, sit down, Bob. I'm not happy, Bob. Not happy. Ask me why.
Okay. Why?
Why what? Be specific, Bob.
Why are you unhappy? Your customers make me unhappy.
What, you've gotten complaints?
Complaints I can handle. What I can't handle is your customers' inexplicable knowledge of InsureCare's inner workings. They're experts, Bob, exploiting every loophole, dodging every obstacle. They're penetrating the bureaucracy.
Did I do something illegal?
No.
Are you saying we shouldn't help our customers?
The law requires that I answer no.
We're supposed to help people.
We're supposed to help our people, starting with our stockholders, Bob. Who's helping them out, huh? You know, Bob, a company
It's like an enormous clock.
is like an enormous Yes, precisely. It only works if all the little cogs mesh together. Now, a clock needs to be clean, well lubricated, and wound tight. The best clocks have dual movements, cogs that fit, that cooperate by design. I'm being metaphorical, Bob. You know what I mean by cooperative cogs? Bob? Look at me when I'm talking to you, Par!
That man out there, he needs
Do
help.
not change the subject, Bob. We're discussing your
He is getting mugged.
Well, let's hope we don't cover him.
I'll be right back.
Stop right now, or you're fired! Close the door. Get over here now. I'm not happy, Bob. Not happy.
He got away.
Good thing, too. You were this close to losing your...
Okay, so I think we could all see where that was going. And just to be clear, I'm not recommending that's how we manage our emotions. What we use on our program is something called the Core Emotional Concerns Framework. Now, again, we covered this in Module 3 and in our Emergency Situations module. We work in an emotional space in healthcare. Most of our conversations tend to have a lot of emotion associated with them. So people are sad, they're worried, they're upset, they're angry, they can be very happy. For example, you know, if somebody's getting better, or in maternity services, if somebody's just had baby. It can, you know, we don't have a lot of time in talking to people sometimes to figure out what's going on, but to de-escalate the emotion in order so we can communicate with somebody, we need to find strategies to help us to do that. So this is one framework that we use on our program, and there are 5 core emotional concerns. I'm going to go through these with you in a moment. The framework was developed by as part of the Harvard negotiation project, where governments from all over the world set up this project in order to come up with a framework that helps us to manage conflict. So the psychologists Dan Shapiro and Roger Fisher came up with this framework, and core emotional concerns are universal. So they identified 5 core emotional concerns that everybody has. If your concerns are in equilibrium and not being triggered, people are usually happy. If one or more of these concerns is impacted, then that's going to impact on the emotion, and we know that's going to affect the conversation. I remember them by talking about the 3 A's, so appreciation, autonomy, affiliation, and then role and status. So just to go back over that again, I hope I was clear in that. We have 5 core emotional concerns. If any of these concerns are impacted, or if you feel that somebody is upset, then one or more of these is going to be impacted. When people are happy, usually these are in balance. So appreciation is how much value I feel. So do I feel valued? Do I feel appreciated at home or in my work? Autonomy, we all need to feel we have some kind of control over what's happening in our lives. So how much autonomy do I feel in relation to my work or what's happening to me? And just thinking about healthcare, it's the first thing in hospitals that's impacted when patients come into hospital, whether it's the emergency department or as inpatients. In general, they lose a lot of their autonomy and control, which is why we teach skills on our program for giving as much autonomy and control back to people as possible. If I feel I've no control over what's going on in my life, my emotion goes up, it's more difficult to communicate with me. So if you do things like, you know, asking permission, is it okay if I sit here beside you? Is it okay if I take the chair? Is it okay if I take your blood pressure? I'm going to go through these options with you, and then we'll talk together about what's important to you. With all of those communication skills, what you're doing is you are giving the patient back some autonomy and control wherever you can in their life. That helps to bring down the emotion. Affiliation is how we feel connected. So do we feel part of a family, a community, a team, a tribe, and so on? We know, and the evidence shows us, that if patients feel they are part of the team looking after them in healthcare, that helps to increase psychological safety. And I'm going to show you some quotes and feedback from patients in a moment to highlight this to you. Role is the next one. We all need to feel like we have a fulfilling role. So do we know what our role is? Is it clear? Are other people clear in our roles? And do I feel my role is fulfilling? Status is our level of importance, like what you feel you're recognized for. So am I recognized as being good at my job? Am I the, you know, the maternal one in the office that everybody comes to if they have a problem? Am I the organized one? I'm going to be in first to set up, and so on. I'm just going to show you some feedback, and these are taken from the patient experience surveys. I've started analysing the patient surveys for communication skills and also for core emotional concerns. And I'm just amazed since I started to use it. You can see the language of affiliation, autonomy, appreciation in everything that patients say to us. And it's particularly good if you're working in the area of complaints. So this is one of the comments from patients. And when you see language like, I felt they were my family, people write that in their feedback. I felt they were on my team. I felt they cared for him as if he were their own, and so on. And this is next quote is where somebody doesn't feel affiliated. If I don't feel affiliated, I don't feel safe. I'm not going to share as easily with you. And my emotion is going to go up. So it's more difficult to communicate with me. So keeping the patient in the loop, explaining what's happening. If I use a lot of jargon, that creates a distance between us. I don't feel affiliated with you if you're using words that I don't understand. The next area, and I'm just going to show you autonomy. This came up a lot in the surveys after COVID. So when people were in hospital or in maternity services having their babies during the pandemic. So we all like to feel we have control over what's going on. And when you see the language of my husband was allowed to be with me, my husband wasn't allowed to be with me, I had no control over what was happening, and so on. So that's autonomy. Here is one where the patient is also talking about autonomy, and it's an area for improvement. I felt vulnerable. If you see the words allowed or in control, not in control, emotion is going to go up. So they're talking about autonomy. So anything I can do to give the patient control over what's happening will help to bring down their emotion. And that's usually about giving the patient choices. Even using a communication skill like, how do you like to be called? It says Winifred Ryan on your chart. How do you like to be called? Well, I go by Winnie. So thank you for giving me that choice. I prefer if you call me Winnie, or no, please call me Mrs. Ryan, and so on. Why are core emotional concerns useful? And here we're talking about self-management. They can be useful to manage your own emotions, and they can be useful to manage emotions in other conversations with other people. So we can use them as a lens. If something is going on, for example, I sometimes use this example, when I am presenting or doing workshops, I leave the house early in the morning. My husband has to get the kids up, get them out to school, all the things that I usually do. I go home in the evening and, you know, he's a little bit out with me, you know, not very happy. And I'm thinking, what's going on? And, oh, okay. Thank you very much for getting the kids up this morning and for looking after them and taking them to school. So do we feel appreciated? Because it affects how we feel if we don't feel valued. Do you feel distant? So if you're not happy in work or you feel your emotions are up, do you not feel part of the team? Do you feel or not feel that you have freedom to make choices? Do you have control over what's happening to you in your work? Do you feel your status is recognized, or do you feel put down? And do you feel fulfilled in your role or unfulfilled? So that's the lens that we can use. It's a shortcut to finding out and figuring out what's going on for you and for other people. We can also use core emotional concerns as a lever to encourage positive emotions. So with my husband, I want him to feel more positive in the evenings. I express appreciation, or I can build affiliation with somebody on the team. I can give people choices respecting their autonomy. I can acknowledge their status, or if I feel unappreciated, I can then communicate that to somebody. The reason I'm a little bit off here is I don't feel what I did is appreciated by the team. So it also helps me to express my needs so that other people know what's going on. So thinking about what you can do, thinking back to that video you saw of Bob in The Incredibles, what do you do to manage your own emotions? We don't recommend throwing people through walls, and it's different for different people. You know, some people like to walk a mountain, some people like to run, some people go out into nature, take a walk, sit by a tree. For other people, it's meditation, mindfulness. So my question to you is just to think about for a moment, what do you already do to manage your own emotions? And this is so important in healthcare for our conversations. And in the space that you're working in, there is a lot of emotion. And if you feel there's a lot of emotion in the room, you're going to maybe feel under stress, under pressure yourself. What do you do to ensure you're first aware of what's going on? And secondly, how do you manage that? Because we know if you can manage your emotions well. Thank you, Vinita. That's a gratitude journal. Yes, they're quite popular as well. So a lot of people write in the journals to think about what they're feeling and what they're going to do to improve that. So I'm moving on to the third area here, which is social awareness. And this is being aware of what's going on around you. Stephen Covey has written a book called The 7 Habits of Highly Effective People, and habit 5 is here on screen. And what he's saying is, if you want to build good relationships with people, first it's about listening to them and listening to truly understand, and then reflecting your listening back to them before you say anything. So let's have a look at these two skills. There are lots of areas, of course, in social awareness under emotional intelligence. The two that relate to communication are non-verbal behavior and listening skills. So social awareness is thinking about other people. So are you aware of non-verbal behavior when you're speaking to patients or to your colleagues? We call it picking up on cues or listening with your eyes. We know, and the evidence shows, that people give us cues to how they're feeling early in the conversation. Why do I use the term cues? Because patients in general, Irish people, are not very good at talking about how they're feeling. We don't really talk a lot about our emotions. So we give cues instead, and we expect people to pick up on those. So if you're wanting to do this, watch the person very early on in the conversation from the beginning and look out for the cues. And what might you see? You can see on the picture here. Perhaps the person is not making eye contact, looking at the ground. Maybe they've, crossed their legs, folded their arms, they're looking out the window. Maybe they look sad. Maybe there's a change in the tone of their voice. If we're not watching to or listening to the patient, we miss these completely. So if I'm writing in the healthcare record or I'm looking at a computer screen, I'm going to miss all of the cues the patient is giving me. What happens when we miss cues? Well, the evidence shows that patients escalate the cues in intensity. So if I was annoyed when I came in and you're not picking up on it, I'm going to escalate to being really angry. That's not good for communication. If we still miss the cue that they're giving us, even after they've escalated, or we just don't bother to pick up on it, sometimes people will just shut down and stop engaging. Do you sometimes see cues and assume you know what they mean without checking with the person? And this brings me on to the next slide that I'm going to show you. Are you watching out for what the person is saying? So listening to the tone of their voice, the pitch of their voice, the content of what they're saying, and also the rate at which they're speaking. You might say something like this: I sense. Now, when we are reading nonverbal cues, you always say them a bit tentatively because you're not entirely sure. Sometimes people say, well, what if I get it wrong? The evidence shows it doesn't matter. People will appreciate that you've tried and they will correct you. but you've given them an opening to talk about emotions. And we know that's not easy in Ireland. So you might use words like, I sense that, it sounds like, from what I'm picking up, you're not quite happy with explanations you've been given in the past. And then you check, is that right? Non-verbal, you're looking at expressions, the person's posture, are they becoming agitated? And you might say, I'm thinking you're quite upset about something. Would you like to talk about that? Of course, there's some caution in interpreting non-verbal behaviors. So, you know, sometimes if somebody folds their arms, it just means they're cold and the air conditioning's up too high. So we always use caution. So when you are, always watch out for the non-verbal cues. That's how you'll know, because people often don't tell us. And check with the patient if you got them right. Don't worry about getting it wrong. The person will appreciate that you tried. Let's move on then to listening skills. And this is another part of social awareness. So it's knowing what's going on around you. There are 3 skills that I'm going to look at in this section. In listening, and this is very, very difficult in healthcare, because when you think about doctors, nurses, other health and social care staff, you spend maybe many years in college learning a whole new vocabulary, learning about lots of different conditions, and we expect you to know that very well. And then you have to get a lot of experience, maybe work as an intern and so on, before, you know, we allow you to become a consultant and that sort of thing. So it's not surprising that people who work in healthcare often have all of this information in their heads, and they come into healthcare to help people. So I'm going to help you by telling you everything that I know. And there is a step between all of that learning and meeting the patient. And we call it beginner's mind. I've heard it referred to as holding your expertise lightly. So you have all the knowledge, you have all the experience, and that's great. Hold that lightly and then sit and listen to what the patient says with a beginner's mind. Because if you are a knower and you think you know everything already, so I've read the notes, I've taken the handover from the nurse, I know your condition, I don't need to hear your story. That's not good for communication or the patient's experience. And also you run the risk of not hearing something very important that the person wants to tell you. So approaching every conversation with a beginner's mind. Open questions are good for this. So they're questions that cannot be answered with a yes or a no. So you see examples here on screen. What we find very interesting when we run workshops around the country is people say, oh yeah, they can give you the definition. I know what an open question is. Okay, so tell me what your open question is. And it'll be a closed question. So whatever way you start your conversations, run that through in your head first, because if the answer is a yes or a no, then it's a closed question. So a question where the person can say anything is an open question. So over to you. You can see the question marks on the screen. What I'd like you to do is just take 1 or 2 of these questions on screen. They're all closed questions. I want you to look at them and turn 1 or 2 of those into an open question, either in the chat or on a piece of paper. How would you turn that question, did you enjoy that film, into an open question? Lucy, thank you. I've seen that. Yeah. Yeah. Lovely. Great. Thanks very much. So it's and what I've noticed since I started working in this area is when I'm talking to my own children, I ask them a lot of closed questions. You know, did you have a good day in school? Are you getting on well in college? Are you finding lots of friends in college? You know, and they're not great for starting conversations and thinking about it. I don't want to hear that they're not having a good time. I want them to be happy with their friends. I want them to be happy in college. The open question allows the person to say anything to you. So I have a curiosity about what you're thinking and what's going on in your head. Closed question is going to close down the conversation. Did you have a good day in school? Yes. I could say, well, how was school for you today? I mean, you're talking to teenagers. It can be difficult to get them to talk, but you know, you're opening it up and you're encouraging the person to talk. When you ask the question, what are you listening for? Because sometimes what we do is we browse listen. You know, when you go shopping and you haven't got a shopping list and you come home with all the wrong things. So we encourage people to be very specific in your listening. What you're listening for is emotion. What's the emotion here? What's the information? What's important to this person? and what's the information they're giving you, and then what's important to them. And you know what's important because the person will maybe pause, maybe the tone of their voice will change, or there'll be more energy behind the words. This is what you're listening for. And when we want to, sorry, I'm getting a time check here. When we want to become good listeners, we have to develop an ability to think reflectively. So you're listening to somebody, and it's like you're forming a hypothesis in your head, and you're asking in a way, is this what you mean? So Thomas Gordon's model of communication is shows us this very nicely. So there's what the speaker says. So if I don't say exactly what I mean, well, that's not good for understanding where you're coming from. If the listener can't hear correctly, so I have a difficulty with hearing, or it's noisy in the background, or so on. Or if I put a different interpretation on what you've said. So you've said something to me, and I've taken something totally different from that. Reflective listening is connecting boxes 3 and 4. So what I think you said and what you actually said. So it is very important when you're listening to feed back to somebody what you think you heard, because often those 2 boxes in the end are not connected. So what's a reflection? I'm capturing what you've said and reflecting this back to you in the form of a statement rather than a question. I'm not saying to you, so you're feeling sad? My inflection goes down. You're feeling sad. Just to play around with this a little bit, over to you with your pen and paper again. So the clinician is talking to the patient and says, how's your shortness of breath been? So that's an open question. And this is what the patient says. It's been better these days. I still have trouble though when I go long distances. The question is, what would your reflection be? How would you reflect that back to the patient? And we reflect to check we've got it right and to show the person that we're listening. So what's your reflection? What would that be? Okay, and I'm just going to pop it up here on screen. And, you know, we'll all, lovely. Thanks, Karen. Yeah, so it's the longer walks that are giving you trouble. Yeah, so that reflection is so important to check my understanding, but to show the person I'm hearing you, and I'm not just maybe hearing the words you're saying, I'm maybe hearing what's going on underneath for you. There are 4 different types of reflection. So sometimes people say, oh, I'm not sure. That's because it can be tricky to get the reflection right. It requires a lot of practice. The simplest form is just repeating back an element of what the speaker said. So try that. Or you might rephrase what the person has said. So more or less saying what the person said, but you're slightly rephrasing 1 or 2 words. So if somebody says something and the word sad is in there, you might say, you're feeling sad. You're just repeating back what you're hearing. More complex reflections are paraphrasing, where I feed back to you what I've heard and maybe continue it on a little bit. I'm kind of guessing where you're going or maybe what you're thinking. And then the 4th one is a reflection of feeling, where I reflect back to you. And this is very closely linked to demonstrating empathy. So just another example here, when the clinician says, thank you. I see some of the reflections coming in the chat. Thanks, Grania. So the clinician says, hello, John, it's good to see you again. Last time we agreed to talk about how it's going with you. How have you been getting on? So a little bit of agenda setting there with an open question. And John says, it's harder than I thought it would be. I mean, I want to do this. So just giving you a moment to think about what your reflection might be. What would you say back to the patient as your reflection? John has said it was harder. I mean, I want to do this. Karen, that's nice. Yeah. Yeah. Lovely. Thanks, Lucy. Some lovely reflections coming in the chat. So it can be something as simple as it was hard. You know, John said it was harder. So a simple reflection is it was hard. Now, if I wanted to make that more complex, I might say something like it was a challenge. It's a challenge to make a change. And because John said, I mean, I want to do this, you're still committed to it. So I'm reinforcing your commitment to change. I want you to remember this screen, if that's okay. If anybody wants to take a picture of it, please do, because we're going to move to summaries in a minute, and I'm going to ask you to summarize, to have a go at summarizing this conversation. Okay. So the next one is, John says, it's hard to remember taking the medication, and I'm embarrassed when I have to take a break at work to take them. So what's your next reflection to what John has said? It's hard to remember, and I'm embarrassed. Thank you, Angela. A lovely note from Angela in the chat. Thanks very much, Angela. Okay, so a reflection might be, yeah, thanks, Lucy. So it might be there are things that get in the way. That's a simple reflection. I'm just really rephrasing back to you, what you said. And then John says, yeah, just tell me what to do, like all the other people in my life. Now, what do I do with something like that? And just because of time, I'm going to show you on screen. I'm going to give you a moment if you want to take a picture of this screen. So the clinician says, you don't like that way of doing things. So something in John's tone has said, yeah, everyone else just tells me what to do. You need to find ways that will work for you. Okay, so I'm reflecting back to John what I've just heard. You don't like it when people tell you what to do, and you're committed. You want to move forward. You need to find ways that work for you. Okay. So we're moving on to summaries. I'm going to ask you to summarize that conversation in a moment, just before we move on to the next section. So what do summaries do? They help us to collect material that the person has said so far. I might link to something that was discussed earlier, and this is a really good communication skill in listening, because the person really feels, gosh, that clinician, that doctor, that nurse, that physio, they're really listening to me because I said that 5 minutes ago, and they're linking it to something I've said now. Or I might draw together, it's a way of transitioning to the next part of the conversation. So it's saying, okay, you've told me your story. Let me just check that I've got it right. And then you're signposting to the person that you're moving on to ask questions after this. So just before we move to the next section, I'm going to give you maybe just about 20 seconds to do this. Kelly, I hope I'm still okay with time. Yeah, I'm just asking people, please, to take that taking medications conversation. How would you summarize that back to the person, to John, what you heard? So John's finished speaking. You want to move to the next part of the conversation. You start with a summary then before you move on. And it's very good if your summary includes some kind of emotional content. You've picked on some, you've picked up on some emotions. Thanks. I'm seeing some coming in here in the chat. So you might say something like, okay, so let's see if I have it. Taking the medication was harder than you thought. You had some challenges, but you still want to take them. So you're committed and you need some ideas that will work for you. Thank you, Lorcan. John, you like to be more in control. Yeah. Okay, so you're just summarizing back what you've heard the person say. So before we move on to the last section, I'm just going to ask you, what one area will you do or focus on to improve your own social awareness? So that's picking up on the nonverbal cues that people are giving you, and also listening and reflecting back what you're hearing, just to check that you've got it right. Maybe you do it already and just to keep working on that, or maybe after today, you might think of something, you might try a repeat reflection. So just hearing a word and repeating that back to the person, or you might try using summaries, or you might try picking up on cues and checking with the person that you've got it right. Mary Rose, thank you, reflecting back. Yeah, resist offering advice, that's a good one. Yeah, holding your expertise. That expertise is essential. It's just holding it for a little while you hear the person's story. So they feel you've heard them, they feel safe, and you may pick up something that you didn't read in the notes or that you don't know already about this person. So moving on, Nuala, not interrupting. Yeah, thank you. And active listening. Thanks, Emma. Delaying jumping in can be really difficult, especially when you know so much. and you want to help the person and you think you have the answer. They don't know that your answer, they will not be convinced that your answer is the right one if they're not happy first that you've heard their story. So moving on to the last section here, which is relationship management. So how do you use good communication skills then in the fourth domain of emotional intelligence, which is managing relationships? This is a very short video clip from the series House MD, and here you're going to see Dr. Gregory House and Dr. Lisa Cuddy.
Hello, sick people and their loved ones. In the interest of saving time and avoiding a lot of boring chit-chat later, I'm Dr. Gregory House. You can call me Greg. I'm one of 3 doctors staffing this clinic this morning.
Short, sweet, grab a file.
This ray of sunshine is Dr. Lisa Cuddy. Dr. Cuddy runs this whole hospital, so unfortunately she's much too busy to deal with you. I am a board certified diagnostician with a double specialty of infectious disease and nephrology. I'm also the only doctor currently employed at this clinic who's forced to be here against his will. That is true, isn't it? But not to worry, because for most of you, this job could be done by a monkey with a bottle of Motrin.
Again, a caution, I'm not recommending that these are good communication skills for building relationships. So in this last section, I'm going to focus on our nonverbal behavior and the skills for demonstrating empathy. And back to earlier slides when I said we're focusing on the words that we use now in our program, I'm going to talk about making observations and how to use observations. So thinking about nonverbals, often when we talk about them in the workshops, we're talking about watching the patient's nonverbals. And I saw some lovely examples coming up here in the chat of people being very conscious of your own nonverbals. So are you making eye contact with the person, nodding to show you're listening, for example, sitting down, as I said, with the patient, using an open posture, not crossing your arms or legs, facing the patient, being aware of your facial expression. If it's a very challenging, complex conversation, you're not smiling, but certainly still maintaining a warm expression. So being aware, again, moving to the balcony, what are your own nonverbals like? Because people who use our services are often very worried. Patients in hospital are sitting for a long time. We know from the surveys they're listening to everything we're saying and watching all of our nonverbals, and they will put an interpretation on those. So just to be aware of your own. Just going to talk about the area of empathy, and very briefly before I move on, just to check what people get you thinking about what you know already, because I'm sure you have, you've talked about empathy a lot. We talk about it a lot in healthcare. What is it? And what are the signs in the conversation, in yourself or maybe in the patient or both, that would show you that you're demonstrating empathy and that the patient is picking up on that? So what is it and what are the signs? Okay, and I'm sorry, I'm a bit conscious of time here, so you probably haven't had time to write your tone while speaking. Lovely, thanks, Nancy. Feeling with someone, yeah, active listening, affirming, nodding, Deirdre, thank you. Okay, so some lovely skills there. Brené Brown has written a fabulous book called Atlas of the Heart, where she talks about emotions and experiences. And I've taken this definition from her book. So Brené says that empathy is a skill set. That's the first point. Because a lot of staff will say to us, well, I feel a lot of empathy, but I get feedback from patients to tell me that, I'm not coming across, back to the intention and the impact. And that's why we call our module Demonstrating Empathy. We know that staff feel empathy. We need skills to help us demonstrate that. So allow us to connect to what someone is feeling, not feeling it for them, as somebody said earlier in the chat. And then what's really important, and that's back to the reflective listening, staff can be very good at picking up what's going on. We forget the next step, which is reflecting back to the patient that I've picked up there's something going on here. I can see that you're sad. I'm aware that I picked up on your tone of voice or something in your body language that says, I'm with you. What's going on here? Brené identifies some amazing empathy blocks, and I am embarrassed when I go through these because I know that I do some of them. So sympathy is not empathy. Sympathy is, I feel so sorry for you. I'm very comfortable here in my nice little comfortable space, and you are way over there, and I'm feeling lots and lots of pity for you. Judging somebody, oh, what a mess this is. Disappointment, parents do this, I think, so very well. Oh, you've let me down. Person's feeling really badly, and oh, you've let me down because I had expectations of you and you haven't met them. Blaming somebody. So this is when we have an opportunity to show empathy because the person is experiencing an emotion and we block it. This is your fault. I mean, what were you thinking in doing that? Minimizing is something that people in healthcare do. The intention is to help the person. So we say something like, oh, don't worry, it's not that bad. You know, I do hundreds of these scans every day. I'm sure you'll be fine. That's minimizing what the person is feeling. And what the person does usually when we minimize is they shut down and they don't share anymore with us. Watch yourself. I have been watching myself for the last few years since doing this program, and I still fall into some of these traps myself. And it's the more aware you are of them, the more you can stop yourself falling into them. This is a really funny one, and we do this a lot in Ireland, and it's come up in the survey and come up in our workshops. You know, staff will say to us, well, is it okay if I share my own experience with the patient? The intention is very good. You're wanting to connect. I've gone through something similar myself. Watch yourself while you're doing it. Watch the conversation. What happens is the other person stops talking because you've made the conversation about you. The intention is to connect. The impact is the person just shuts down. It's almost like we're competing with them. You know, if you think your experience is bad, wait till you hear what happened to me the last time I was in ED. So not competing and advising. I think somebody put that in the chat. When somebody's in the middle of an emotion, if you jump straight to solutions, and I think this is what you should do. I know exactly what's going on. I'm not with the person in the moment demonstrating empathy. I can move on to the advice and the solutions at a later point in the conversation. For now, I'm staying with you in this moment. I can see you're experiencing a strong emotion. I'm staying with you to give you a safe space. And Mohammed, thank you. Yeah, sometimes people just want to be heard. And I think this is what's so difficult for healthcare staff. We're mostly problem solvers and doers. I want to help you. We find it difficult to unlearn all of that and to appreciate that sitting with somebody and just listening to them, nodding, reflecting back, that's what the person needs at that point, and that's what they really appreciate. And you are doing something by doing nothing. There is a phrase, if I can remember it correctly, don't just do something, stand still, which I think is a nice one. So what do we need to do in healthcare? We need to build a vocabulary for emotions, which is called emotional literacy. It's just a fancy name for it. And it's really, how many words do you have for describing your own emotions? You can see them listed here. So there's a family of emotions for happiness, a family of words for sadness. Some of the words at the top are a strong way of describing it, and at the bottom, a weaker way of describing it. So why am I pointing this out to you? It's because in general in healthcare, it's best to understate an emotion that you're seeing. So you might say to somebody, you look a little unhappy or downhearted. You know, if I say to someone, oh, you're looking completely hopeless, in general, what happens is, thank you, Kira, that's a lovely comment in the chat. In general, what happens is that people shut down. So if you have overstated my emotion, I'm going to shut down and back off. I don't want to talk about it anymore. If you understate my emotion, it encourages me to keep talking about it. First, build a vocabulary of emotions for yourself. I mean, do you use these words to describe how you are feeling? Because if you can do it for yourself, you're more likely to do it for somebody else. I'm feeling sad. I'm disappointed. I'm feeling low. I'm feeling a little down. People give us opportunities to demonstrate empathy. The direct ones are rare. So this is where the person is describing their emotion. But they might say something like, now I'm scared, or I've been really depressed lately, or so on. So that's a direct opportunity to demonstrate empathy. Watch out for these in your conversations with people. They give us a lot of opportunities to demonstrate empathy that are indirect. So why me, or crying, or oh no, or I think I'm getting worse. So they are indirect opportunities to demonstrate empathy. Or expressions of extreme pain. So all of these are opportunities for us to be with the person and demonstrate empathy. That's what they need at that time, not the solution, not the advice, not the disappointment, just sitting with me, giving me the space to express this emotion. And sometimes the language to express it, because in general, we're not good at expressing our emotions. So over to you, just very briefly before we finish, pick one of these. If the person says, you know, I've been really depressed lately, one of those, what might you say next? Tell me what you're worried about. Okay. Tell me what's making you sad. Yeah. I'm sorry to hear. Yeah. Quiva, I'm sorry to hear you've been having a hard time. Yeah. Lovely. Can you describe? Open is very good. Yeah. Encouraging them. If you ask a closed question, it can stop the conversation. Open question. Can you tell me? Tell me about that. They're all good ways of doing that. So empathic responses, there are 4 types. So you can make a statement like, you know, this can be incredibly frustrating. Wish statements is another way of expressing empathy. So I wish I could tell you something different. You know, sometimes there is no more you can offer the patient, or you know that it's really bad news. I really wish there was something else we could do. Naming the emotion, so I can see that you're sad. Again, it's tentative, or acknowledging the emotion. This must be hard. I can't imagine what you're going through. So lots of different ways of expressing empathy. I know I'm going quickly through these slides at the end, and I know that Kelly is going to send you a PDF of the slides. So if you haven't picked something up, it'll be on the slides later on. I have 2 more slides that I'm going to show, I think, Kelly, because I mightn't go through the observations. I think we're running out of time. Is that okay with you?
Yeah. No,
okay.
that's good. Thanks, Wini.
I just want to make this point, because, you know, sometimes people say to us, well, why is it so important to build a vocabulary of emotions, or even to demonstrate empathy? And this is why, because there is no better way of creating a connection between yourself and the other person. Because emotions are universal. We all share them. We're all going to feel sad, happy, worried, and so on. And we know that in Ireland, we find it very, very difficult to describe our emotions. We're not encouraged to do so when we're younger. Hopefully that will change. So people are giving us cues that they're worried, they're angry, they're sad, because they want to talk about it. They don't have the vocabulary themselves, and they're not sure that they have permission to do so. So you're giving them permission to feel their emotion. You're staying in that space with them. You're giving them a language to describe it, perhaps. And that helps to create a connection between you. And if we focus on emotions, it helps to de-escalate the emotion. We discover our shared humanity, and everything seems to flow much better in the conversation after that. Before I go to the closing, this is a picture of my daddy. He died earlier this year. And we miss him. You may wonder why I'm sharing it, and it's because I've learned from Peter Gillen, who runs the workshops with me. When Peter wants people to remember a skill, he tells a story, because if you tell a story, sometimes that's what people will remember, and it helps them to remember the skill. My dad had a saying, and he said it to me and to all of his daughters, which was, Winnie, if you take care of yourself, you'll be able to take care of the children. Or another way of saying that is, if you don't take care of yourself, you won't be much good to the kids, and so on. So the reason I'm using this slide here is, and I wish I'd listened to him, of course, when he was alive. The reason I'm sharing this with you is because in order to demonstrate empathy, which is what everybody wants to do in healthcare, the first thing we have to do is to be able to do it for ourselves. So if you are hoping to improve, and we can all do with improving our skills all the time, no matter how skilled we are, your skills for demonstrating empathy. First, thank you, Pauline. First, demonstrate empathy to yourself. So if you're in a difficult situation, you're feeling a lot of emotion, pause, take a moment, describe what's going on to yourself. I'm feeling disappointed that happened. Give yourself some empathy, take some time out, because if you can do that for yourself, for your family, for your colleagues, you're more likely to do that then with your patients. I'm going to skip the next few slides, but they will be coming out to you on I feel we don't have time, and I do want to leave some time for questions. Thank you, Patricia. So just before I go to closing, what one area might you focus on to improve your skills for relationship management? Your non-verbals, your skills for demonstrating empathy. What one thing will you do? And we always encourage people to identify one and no more than 3 things, because you're not, you know, if you say, I'm going to do the next 20 things when I leave this webinar today, I'm going to do these 20 skills, then you're less likely to do that. But focus on one skill. You'll be improving your communication skills for the rest of your life. You can take your time, one at a time. Self-reflection. Thank you, Erin. Be kind. Name the emotion. Empathy. Thank you. Open questions. Thanks, Ella. Listening to your own feelings and naming them also. Pausing. Lovely, some lovely skills coming in there. So just while people are popping those in, if you want to scan the QR code here on the screen, that will take you straight to our app. And we have a lot of materials on our app, particularly in the modules section that you can see there on the app. If you click in there, you will see, you'll have access to our skills cards, our videos, the posters, and so on. Sorry, I'll leave it up so people can do that. Lorraine, I'm going to stop there. I don't want to go over time, and I know people might have some questions.
Thank you, Winnie. I think Ellie's going to take you through a few of the questions. That was extremely powerful. Thank you so much. Over to Ellie.
Thank you. Thanks so much. And Winnie, thank you so much. That's given me so much myself to reflect on. But I will, I'll go to other people's questions first. Our first question was from Louise Morris, who says, Winnie, excellent content. I work in suicide prevention. Can you recommend training around breaking bad news in such an instance within a clinical setting? Thank you.
Thanks very much for your question. So, and I'm very happy for people to contact me directly by email also after this, which, and well, I'll give Kelly the email address. So in general, we use, I didn't speak about it very much, but we use a modular approach for teaching communication skills, because we know that you can hear about a skill in a workshop, but you do need to go away probably and practice that so you're comfortable with it before you come into a more challenging conversation like the ones that you're talking about. So I would recommend starting with module 1 and then moving through the modules, module 1, 2, and 3. 3 is where we talk about very challenging conversations like the one you're describing. We hope over time to make videos about all of those kinds of conversations. So if there are particular scenarios you're interested in, the workshop is the same because the skills are the same for every conversation, but you could insert the video, and that's something we could work with your services on, maybe developing a video for that particular scenario to use in the workshop.
That's great, Winnie. Thank you so much. And that almost feeds into the next question that I was going to raise around open disclosure and incident management, where very often our colleagues and ourselves have to step into an episode of care or relationships surrounding a patient safety incident which is already established. And I was going to ask about any tips for engaging with patients and their relevant persons who have maybe already made some judgments about this service and the care received, but I think you kind of answered that, but I'll give you the space to respond.
Yeah, thanks very much, Ali. So, and mostly it's about, you know, using all your positive nonverbal behavior first, because remember, people are watching us from the moment that you're walking down the corridor, walking into the room. So are you being open in your nonverbals, engaging, and then sitting and listening really to people? You know, it's back to Stephen Covey's slide, which is seeking to understand before we give any information. The best communication skill for de-escalating emotion is listening to understand people.
Thanks. One last question we had about a quick reference place for staff to go to when preparing for breaking bad news, like that they might not have time to attend or witness all of the training and need some prompts.
Yep. Thanks, Ellie. So I would suggest downloading the app onto your phone and go straight to module 3. And we have skills cards there because people have said to us, you know, when they leave the workshops, can you just give me a phrase that I can use? Or, you know, even it could have a starting kind of form of words to get me into the conversation. So on our skills cards, we have suggested phrases and lines that you might use. And then you'll have access to a video on delivering bad news. And there is a skills debrief with each video that explains in detail all of the skills and why those particular skills are used. So I would say go to module 3, and if you have any other queries, come back to me on that.
Thank you ever so much, Winnie. That's so kind and very generous of you to offer your email address. And I'm sure colleagues will take advantage of that once they've had a review of the slides and the webinar of today. So thank you again on behalf of everybody who's been in our audience and our open disclosure team. I'm going to start sharing some more slides here from my end because, as Lorraine promised at the beginning, there are some updates that we would like to share with you all before you leave.
And I suppose just from me as well, no, when you switched off there, the screen, but just to say huge thank you. The presentation, as I said, was really powerful. There were some really practical tools and just insights that you've shared with everyone. And I think you've hit the nail on the head that everybody in healthcare tries to do their best, has empathy, but maybe it's challenging just communicating that effectively sometimes. So it's really an area that obviously we're so keen on, an open disclosure and supporting people and having those very difficult conversations sometimes. So this must have been invaluable. And even with the changes that are going on across the organization, some of those emotional triggers, just having that self-awareness, I think has been really impactful. And sincere condolences around your father as well. That was a really lovely photo, and thank you for sharing that with us as well. Okay, so now more to the drier part of our job, but very, very important. You know that we've been leading up to the implementation of this important legislation, and particularly important in the open disclosure space. Also touches on clinical audit and elements of screening. So we have confirmation from the Department of Health that the Patient Safety Act will commence. That's very much the legal language that's used on the 26th of September. So next Thursday. So we're 1 week away. That really means that the act will become live. So it's a piece of legislation that we will have to follow starting on that date. You will know from some of our previous sessions that it's very specific in terms of the open disclosure requirements for a very short list of incidents. There's 13 notifiable incidents the Act lists. Whenever one of those very serious incidents occurs, then we have to apply the Act. That means we need to undertake open disclosure as set out in the Act, and the health service, so your employer, needs to notify the regulator of that notifiable incident. We have lots of resources to help you with that. It will only apply to any incidents that occur from next Thursday onwards. So it's not a retrospective piece of legislation. But I think the key message from us is you have been doing this. You are doing open disclosure. There's a good culture across the organization. And this piece of legislation just further cements that, because as we know, it's not just applicable to the public healthcare sector, it's also applicable to the private sector. Okay. So in preparation for the commencement, which obviously we've been working on with a lot of colleagues in the HSE, a lot of patient partners, advocacy groups, we've prepared a number of resources. You have our webinar series that's available. We do have an e-learning program. I think we highlight that on the next slide. We've visited many sites in person and some virtually as well. And certainly our team is available to support you on an ongoing basis with the implementation of this legislation. We think these incidents will be very rare, but if you or your organization have any concerns or want to run things past us as the Act commences, don't hesitate to get in touch with our open disclosure email which you will know. We'll put it in the chat as well, and we will get back to you very promptly. We'll be keeping an eye on it in particular during that time. Okay, next slide, please. So we have the e-learning program. You can access that on HSE land. We're just trying to finalize the CPD points to go along with it, but you can already access it, and it gives you a very good oversight in terms of what the legislation means, what it means for you and your role. Importantly, for all our frontline staff is to report the incidents and escalate them internally. Next slide, please. As you know, we've had webinars on this topic as well. We put a lot of emphasis on the role of the designated person. So the designated person is an employee of your organisation who's there to support the patient or their family when there are incidents. It will be a legal requirement under the Patient Safety Act, and with the team in particular, colleagues Catherine Hand and others have developed some really nice resources, and there is an e-learning program available on HSE land, and we have a role description which we've circulated as well. Next slide, please. And just to remind you, we have sent out the revised or updated HSE open disclosure policy. We've obviously had to incorporate some of the requirements of the legislation, and we've taken on board some of the learnings around open disclosure over the last number of years. And we know we've been on a good journey in that space, and this is really just building on previous developments. So please do provide us your feedback. You are the persons who are implementing it, you are the persons who are impacted by patient safety incidents, and we want to obviously make sure that the policies as robust as possible to help you on that journey. Okay. And as ever, we'll be sending you out an evaluation. Your feedback is very welcome. We've had a bit of a discussion in terms of inviting people to say where they're from or not. Some people find it distracting, but we feel it builds a community, so we might ask you for feedback on that specifically. And we want to thank you. I want to thank the team in particular for organising today. Of course, Wini Ryan, who's been an absolute star giving her presentation, and to our support colleagues providing the sign language piece, which is really invaluable as well. Hope you have a lovely rest of the day and great week, and do get in touch if we can help you with anything. Thank you. Bye.